Can deep brain stimulation cause hypomania? Have you ever wondered if deep brain stimulation can lead to hypomania? This is an important question for those managing Parkinson's disease and considering treatment options. Deep brain stimulation, particularly when targeting the subthalamic nucleus, is a well-established method for alleviating motor symptoms in advanced Parkinson's disease. However, it is crucial to understand that this treatment can also bring about psychiatric side effects, including hypomania. Hypomania is a mood state that features an elevated mood, increased energy, impulsivity, and sometimes risky behavior. It is less severe than full mania. Research indicates that, in patients with Parkinson's disease undergoing subthalamic nucleus deep brain stimulation, hypomania can occur as a potential adverse effect. Studies show that between 4 to 15% of these patients may experience hypomania or mania, often shortly after the stimulation begins or when adjustments to the parameters are made. The underlying mechanism for hypomania related to deep brain stimulation is linked to the complexity of the subthalamic nucleus. This area of the brain has subdivisions that manage motor, cognitive, and emotional functions. When stimulation affects the emotional or limbic areas of the subthalamic nucleus or nearby structures, it can disrupt mood regulation, resulting in hypomanic symptoms. Additionally, factors such as microlesions from electrode implantation or the specific frequency and location of stimulation may also play a role. Interestingly, some patients may not recognize their hypomanic behavior, but family members or caregivers might observe changes like increased impulsivity or an elevated mood. Adjusting the settings of the deep brain stimulation can often alleviate hypomania while still providing motor benefits. This highlights the importance of carefully managing stimulation parameters to balance improvements in motor function with the potential for psychiatric side effects. Certain factors may increase the likelihood of experiencing psychiatric symptoms after deep brain stimulation. These include pre-existing psychiatric conditions, advanced age, and how a patient responds to dopaminergic medications. Despite the risks, it is worth noting that deep brain stimulation can sometimes lead to improved control over impulsivity in certain individuals. In conclusion, yes, deep brain stimulation, especially when targeting the subthalamic nucleus in Parkinson's disease, can indeed cause hypomania as a side effect. This is a recognized complication that can be managed effectively with close monitoring and adjustments by healthcare professionals. If you or someone you know is considering deep brain stimulation, it is essential to discuss these potential side effects with a healthcare provider to ensure the best possible treatment outcomes for both motor and non-motor symptoms.